Good day. My name is Maged Rizk, and I am the Associate Director for the Cleveland Clinic Medicare Accountable Care Organization. I'm also a practicing gastroenterologist. On behalf of our research team, I'd like to thank the editors of GI Endoscopy for the opportunity for us to present our research. Today, I'd like to provide some detail about our research group's recently published manuscript, Application of Optical Character Recognition with Natural Language Processing for Large-Scale Data Extraction from Scan Procedure Reports. Colonoscopy is commonly performed for colorectal cancer screening in the United States. Observational data has shown that colonoscopy screening has led to lower colorectal cancer incidence and mortality. However, increasing evidence suggests that examination quality may impact its effectiveness. Unfortunately, the information needed to assess colonoscopy examination quality is often embedded in non-standardized colonoscopy procedure reports of varying formats within electronic health records, requiring time-consuming and costly manual data extraction for accurate reporting. Manual extraction of important clinical variables from these procedure or pathology reports is limited by its labor, resource, and time-intensive nature. Absence of tools that allow error-free extraction of high-quality information has remained a major obstacle in navigating these unstructured data sources to impact the efficiency and accuracy of patient care. Natural language processing, or NLP, is a computer-based linguistic technique which has gained prominence for its role in obtaining pertinent clinical information in an organized fashion from semi-structured or more recently unstructured data sources. This not only has the potential to impact clinical practice, but has opened pathways towards investigational and quality research that were previously unfathomable. Though extremely useful, the application of NLP is limited in scope as it requires machine-readable clinical text and does not work with print or scanned documents. Optical character recognition, or OCR, is a technology that enables conversion of scanned paper documents into editable and searchable text data. Application of NLP on documents created using OCR-based technologies has not yet been studied. The aim of our study is to demonstrate the use of a new hybrid approach utilizing natural language processing of charts that have been elucidated with optical character recognition, an OCR-NLP hybrid, to obtain relevant clinical information from scanned colonoscopy reports and pathology reports. This was a retrospective study conducted at Cleveland Clinic and the University of Minnesota. The study was approved by the Institutional Review Board at both institutions. The NLP algorithm was used to obtain data on all patients who underwent a screening colonoscopy at Cleveland Clinic between 2010 and 2014. We had collected data for a previous study on 2,530 patients after excluding those with prior colonoscopies, procedures done for diagnostic indications, and those on patients less than 40 years of age. These patients were arranged in a numerical order of their medical record number, and every third patient was included in our study for a total of 589 procedures. This was done to utilize the data that was readily available to us. Data and desired variables were then collected in three ways. First, the colonoscopy procedure reports were manually reviewed by two researchers to ensure that the previously collected information on the variables of interest was accurate. Any discrepancies between the data sets obtained by the two researchers were resolved by a third independent researcher. Second, the natural language processing algorithm was used to obtain the same variables directly from the three EHRs being used at our institution: Epic Provation, used for endoscopy reporting, and Sunquest PowerPath, used for pathology reporting. Lastly, the third OCR NLP technology, co-developed by Cleveland Clinic and eHealth Technologies, was utilized to evaluate a scanned copy of each procedure and pathology report to extract our variables of interest. Since our NLP algorithm was developed using the procedure notes written only at our institution, the external applicability of our algorithm to extract data from procedure notes written at a different institution would have remained questionable due to the possibility of significant variation in procedure note templates. To overcome this, data was also obtained through manual review as well as via OCR NLP approach on 4 variables specifically indication, quality of bowel preparation, cecal intubation, and polyp detection from 30 randomly selected colonoscopy reports of patients presenting to the gastroenterology clinic at the University of Minnesota. All these procedure notes were written using the Next Gen Healthcare Information System version 5. Polyp detection rate, location of polyps, adenoma detection rate, advanced adenoma detection rate, rate of inadequate bowel preparation, and cecal intubation rates were all assessed. A total of 589 colonoscopy procedures were included in the study, and there were 262 corresponding pathology reports. The overall adenoma detection rate was 23.1% in our study, and rates of inadequate bowel preparation was 16.9%. Advanced adenoma detection rate was 4.1%, and failed cecal intubation rate was 1.6%. When compared to manual data extraction, the hybrid OCR NLP approach was able to detect polyps with an accuracy of 95.8%, adenomas at 98.5%, sessile serrated polyps at 99.3%, advanced lesions at 98%, inadequate bowel preparation at 98.4%, and failed cecal intubation 98.9%. Upon comparison of the data set collected via NLP alone with that collected using the hybrid OCR NLP approach, the accuracy for almost all variables was greater than 99%. Our hybrid OCL NLP technology has sensitivity, specificity, positive predictive value, and accuracy of 100% when extracting data on indication, quality of bowel preparation, cecal intubation, and polyp detection as compared to manual annotation for 30 colonoscopy procedure notes from patients at the University of Minnesota. Our team presents a novel approach to overcome the barriers of natural language processing by introducing OCR that allows recognition processing of text contained in printed or scanned documents. However, there is great potential for this technology. Healthcare systems where procedure and pathology reports are scanned into the EHR, elucidation of these reports by OCR and then subsequent NLP will assist these practices in extraction of colonoscopy quality parameters for their own internal monitoring, as well as allow them to report and participate in national registry programs such as the GI Quality Improvement Consortium, otherwise known as GI Quick. It will also allow practices to employ merit-based incentive payment system, or MIPS, which most shy away from given the burdensome labor costs. The results of this proof of concept study create a new frontier for the use of large-scale data extraction from scanned reports that was previously limited by lack of appropriate technology. The process, which was previously expensive and time-consuming, can now potentially be accurately done in a time and labor-efficient manner. Lastly, we would like to recognize Colin Rhodes, former Chief Technology Officer of eHealth Technologies, who was vital in the development of this technology and who passed away prior to this publication. This is dedicated to him, as none of this would have been possible without him. Thank you.